hard palate, soft palate, lingual frenulum, and this would be the back of the tongue, so this area would be the pharynx. Oh, there we go. There's the pharynx. This is the this is the epiglottis, and that covers the top of the trachea, so this is the esophagus. So here's the trachea, which leads down to the lungs, branches into the bronchi and then into the lungs. And so you've got the left anterior and middle and posterior, right anterior, middle and posterior, and mediastinal lobe. And then at the heart, we've got right side, left side. So the aortic arch is this right here, it's arching around. The first branch is the right brachiocephalic artery, then the left subclavian artery, and then there's the blue going back into the heart, this is superior vena cava, and there's inferior vena cava. And then from that point, where we cut it, that would be descending aorta, which goes through the diaphragm and all the way behind the intestines. This is the diaphragm. And then the lobes of the liver, there's left lateral, left medial, right lateral, and caudate, that's the fifth lobe. And then this is the stomach. The very top, right up there, is a sphincter called the cardioesophageal sphincter. And then the top of the stomach over here is the fundus. The center part is the body. And the last section here is the pylorus. The outside curve is the greater curvature, and attached to the greater curvature is the greater omentum. And in the greater omentum over here is the spleen. So we've got another sphincter here. This is the pyloric sphincter, because it's right after the pylorus of the stomach, and it leads into the duodenum, which is the first about 4 inches of intestine. And when it was attached in here, this was right next to it, and that's the pancreas. And so after the duodenum, this kind of winds around, turns into the jejunum and ileum. And the very last part of the small intestine, which is still ileum, and here it is. It's coming in here, and it goes from small to large. So this is the ileocecal valve. That's another sphincter. This little pouch is the cecum. And the way the intestine would sit, the way the colon would sit in the cat is kind of like a question mark. And so you'd have the cecum, then there's the ascending colon, which is this first part going up toward the head. The part that goes across is transverse, descending colon, and then rectum down here behind the bladder. The kidneys, there's a kidney and the renal vein. Can't really see the renal artery there, maybe the backside. Usually the arteries are easier to see when you turn the kidney over. And where's the other one? There it is. And so this one we cut in half, the cortex, the medulla, and the pelvis, which is this collecting area right there. And the kidney then sends the urine down into the ureters, which looks like that one's still under the membrane. This one, it's that tube that goes from here down to the bladder. So that's the ureter, urinary bladder, and urethra. And then the reproductive, we've got the ovary with the uterine tube into the uterine horn. And the place where the two uterine horns meet is the body of the uterus. And then behind the urethra, down here, this is the vagina and the urogenital sinus where the two tubes meet.
Yeah, cut it.
I think that's it. Oh, there's a couple of things I forgot. The mesenteries, I forgot the mesenteries. I forgot the gallbladder, which is right there. I think that's about it.